Emergency and acute care systems in low and middle income countries are critically important and well underdeveloped from what we've experienced in high resource countries or take for granted. In many parts of the world, we've focused on trying to control various types of infectious disease. Yet today, more than 50% of lives in low and middle income countries are lost through time-sensitive emergencies.
There is a collective hallucination among people with power and among people with money that no matter where you are in the world, if you fall over in the street, either because you were hit by a bus or because you had a heart attack, that there will be a number to call to ask someone to come help you. And that if someone comes to help you, there'll be a place to take you where there is someone waiting to care for you 24 hours a day. There are many, many, many countries in the world where none of these things are true.
Every second death on Earth is a time-critical emergency. And we need an organized healthcare system to address them because they can be prevented by a common set of interventions.
It could be as simple as stopping traumatic bleeding long enough to get someone to a hospital. But if there's nobody close to you that observes an accident, that knows to put pressure on a large wound, then you may not survive to get to the hospital.
We have learned, especially in the past few years during the pandemic, how vital it is to have comprehensive, integrated emergency, critical and operative services that can meet the needs of communities at different levels of care to ensure that we achieve universal health coverage.
The American Heart Association, WHO, Laerdal Foundation are launching the Acute Care Action Network, which is really an alliance of like-minded organizations that want to support this effort, that have technology or resources to help accelerate the establishment of systems of care for emergency response.
We have a history of working together, and I think by pooling our resources, it's much more than pooling funding opportunities. It's really pooling commitments and competencies in trying to build a network that can be synergistic and invite others to take part in this and really establish a set of best practice implementation.
It is fundamentally a way of doing more together than we could ever do apart. We have a range of tools that support health workers. These are trainings in some sense, in a classic sense, like you might expect, but they're also clinical decision support tools that help amplify the capacity of health workers who are faced every day with the acutely ill and injured.
For us as Ethiopia, we have been investing in different initiatives in improving emergency critical operative care services, and this has shown us that the need to have an integrated investment is critical. We are very happy that the Acute Care Network is being announced as part of this eco-resolution, which requires the coordinated efforts of governments, donors, partners, private sectors, communities and non-state actors to really work in strong partnership.
We hope the impact of the Acute Care Action Network will be to integrate the existing infectious disease and chronic disease activities with the emergency response resources that are needed to extend care and stabilize patients outside of the hospital.
There is too much work to be done, and there is so much redundancy in what we're currently doing. Fundamentally, the Acute Care Action Network is a way to bring together people who have extraordinary contributions to make and make their job easier.